Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. Where you are taught that true health is really wealth. We want to thank you guys for being here on today. And we see your messages coming through telling us to start. We are here. We are here. So come on in and join us. We'll be sharing this just as well to make sure that those of you who are joining us are here. We would just want to say, hey, we're going to go around the table as we always do on Monday nights and introduce our esteemed panel that is here with us on this evening. And I'm going to start with our fellow co-worker here, Douglas Graham. Doug.
Hey, thank you, Nikki. I'm a retired physician. I worked in the western suburbs for 30 years. I also spent 2 years in the congressman's office working as a congressional fellow. It's a real honor and a pleasure to be here. I'm going to do my best to answer your questions if I can.
Outstanding. To the doctor they call Dr. 100, who always keeps it real. That's our very own Dr. Maya Green. Dr. Green.
Hello, community. Hi, Nikki. Hi, Congressman. Thank you for organizing this and having it. It's a couple of things we're going to keep it 100 about tonight. So I'm excited to share and learn from the community and my colleagues. Thank you.
Don't you believe it?
And I'll popcorn it over to Dr. Mason.
Well, thank you, Dr. 150, because you keep it just that real. I want to thank you and thank the Congressman for this. Thank you for the introduction. Thank the Congressman for the introduction of this forum to our community. I think it's a wonderful thing, and I'm only happy to be able to add whatever I can to help him get the word out to the people of his district and all over the city and the world that are listening. So thank you for the opportunity.
Outstanding, Dr. Mason. To the guy who says I threatened him to be here, but I let him take a vacation and he's been gone for a few weeks, but he is back. That's our very own Dr. James Miller. Dr. Miller.
Oh, good evening, everybody. So happy to be back and join in this usually very stimulating, very informative conversation. So we're happy to be here and thank Nikki and Congressman Davis for providing this forum for us and for the community. So we are all about a healthy community, a healing community. So let's go.
All right. To the man who think he's the Wolfgang Puck, that weight loss guru of medicine, that family practice doctor, our very own Dr. Tony Hampton.
Hey guys, I am always happy to be with my esteemed colleagues. The platform that the Congressman has laid out for us is wonderful. I think it's, what we have to do. We have to give back to our communities, share what we know, and hear what you have to say. So I work for Advocate of Rural Healthcare on the south side of Chicago. I'm a family doctor. I spend a little extra time with my patients who struggle with obesity. And of course, I'm all about metabolic health, helping people to heal and reverse chronic diseases. So let's have a good show tonight.
Outstanding. I want to say hey to Nellie Purnell, who is here. Hey, Miss King, how are you? I want to say hey to Reed, who is here. Tia Reed is here, and she says hello to everyone that's here. So to those who are here, we've gotten some of your questions about monkeypox, and we know we're going to head right on into there. But before we do that, to the guy who makes this possible for us on every Monday night, to one who knows that health is truly wealth, who just dropped off. I don't know what happened. Okay. All right. So while we're working to get the Congressman back on, we will start with our very first question. So our very first question is, I've been concerned about monkeypox and wondering if I should get vaccinated. Then I saw in the news on Friday that Illinois is the third highest state with its rate of monkeypox. Can you please give us details on how this happens, how it's spreaded, and what we can do? Okay. So don't everybody jump at that question at the same time. Oh, go right ahead, Dr. Moya. Let's go.
That one. All right. Monkeypox. All right. So monkeypox is an orthopox virus. It's a cousin of smallpox and other diseases that we know about. Before I start a whole history of it, let's just remember, y'all remember when Dr. Mason brought up smallpox during COVID? And everybody was like, what? What's that? Smallpox vaccinations. And people was like, I don't know what a smallpox vaccination was. Exactly. The last time we've given the smallpox vaccination in the United States was 1972. And why? Because people joined together at that time, got the vaccination, and fixed it. So people like me never even had to get it, right? So here's the thing: monkeypox, the cousin of smallpox, is endemic or usually occurs in other continents, not the US, right? So endemic means just a small thing. Endemic means it happens within a certain community. Epidemic means it's happening in that community more often. And like if we used to 5%, then now it's 20%. That's an epidemic. Pandemic is when it gets in a plane, a train, or automobile, plane, train, boat, and comes across to other places, and it's been in the world. So right now we have an outbreak of monkeypox, higher in rates than we usually see. And once again, we have the opportunity to band together. Now, there is a vaccine. That vaccine is the same vaccine we haven't seen since 1972. It's the same vaccine we use for smallpox. It's called Jynneos, or how we call it here, Jynneos, right? Jynneos, right? And there is a precursor to Jynneos called ACAM, but that's a vaccine we generally don't give. But if you see people with that little, with a little circle scar, sometimes the ACAM did give that. There's a vaccine for it, monkeypox. And monkeypox, let's be clear, is transmitted skin to skin. That means if I have monkeypox on my hand, and I touch the hand to it, it's transmitted like that. It's also transmitted by respiratory droplets, meaning if particles, and think about why, right? If I have a lesion of monkeypox on my hand and I touch skin to skin, it spreads. Monkeypox also can be applied to the soft, like cheek materials inside the body's other cavities inside your body. Lesions can also be there. So if I have a lesion, say I have it right here, we're seeing some people with it at the top of the mouth. Say I have a lesion there and I'm talking, coughing, things like that. The fluid from inside that lesion, then I'm letting it out, but it's droplet. Droplets are things that once they come out, they drop to the ground. That's not airborne. Airborne are things that float. So monkeypox is a virus. It's transmitted skin to skin or drop to the ground, droplets. It's spread that way. And so for that reason, we advocate that when it's your time. So thank you, whoever asked about the vaccine. When it's your time, go ahead and get the vaccination. Now, what do I mean by when it's your time? Right now.
Well, that leads right into our next question. So that is great, because the next question is, who should be vaccinated and when? So please go right ahead. And in their question, they're also wondering, is this similar to COVID when there are tiers and age demographics? So go right ahead.
Okay. So who has it? Right now, it's transmitted on the skin and the genital area, right? So think about it. If I have a lesion in my genital area, the people who touch that lesion, usually people that I'm coming in intimate contact with, are then going to get it. Does that make it a sexually transmitted disease? It's a disease that's transmitted sexually, but it's not exclusive. It's skin to skin. If I have it on my hand and it touches, people get it. Okay, so let's not get it twisted. It is skin to skin contact, right? So right now, there is a population, men who have sex with men, or people who have sex with men who have sex with men. If I'm bisexual, gay, however I want to, or none of your business. If you're having sex with someone, a man who has had sex with men, the city of Chicago is recommending that you get the vaccine. Why? Because, and why does this work? Why is that the focus group if I just told you it was a skin to skin thing, right? If we focus on the population we know it's in, we're essentially taking that population all the way back to 1972 and saying, hey, if this population gets it, then the rest of us, then we'll be like, what smallpox vaccine? I never heard of that, And so, right, and that's what focused populations mean. All right. I hope I said that clearly. So, is it age? The young youth vaccination is indicated 18 and older, right? It's important if you're 18 and older and you're in that group, you get it just like we did the COVID for people that are 17 and younger who don't yet have the opportunity to get it. Why? Because it's skin to skin contact. Now, the most important thing about the vaccine, I'll just add this and then I'm trying to like get all the information out and then we can move on. The most important thing I want to know about this vaccine is like what happens, right? Because some people just got, the COVID vaccine not too long ago. They didn't like that experience. Two things about this vaccine. COVID, flu, other vaccines, they go in your muscle, deep in the muscle, all the way down to the muscle. So while you feel a nodule when you touch it, you're like, you feel this nodule more for the Yanyos or Genios vaccine because we're going to put it right in your skin under your arm. So just because it's more at the surface, you're going to be able to tactile feel it, right? And you have more nerve endings on the skin than you do deep. So there's a little thing. Now, what it does not do, so that's what it does. Sometimes you feel a little tired, more like, not like COVID, more like how you feel when you got your flu vaccine, right? You're not going to feel that myalgia, muscle ache, oh, I got to take the whole next day off. It's not giving COVID vaccine, post-COVID vaccine symptoms. That's not what it's not going to give you that. And I know a lot of people, that's the reality. They did not like that. But I want you to think back to all the 25 other vaccines you got prior to the COVID vaccination, and it's more aligned with that. So you're not going to feel post-COVID vaccine-y, is what I call it. You're not going to feel like that after this vaccine. A lot of people are getting the vaccine, going back to work, going back to their lives, things like that. That's in a nutshell. Oh, one more thing about it. As of the 22nd, I'm not sure what today is. My days are blurring together. Today's the 25th, I believe. As of July 22nd, the recommendation from the Chicago Department of Public Health is that all the eligible people receive right now the first dose. And then upon further recommendations, they will let us know when it's time to get the second dose.
Okay. All right. Very good. So Tia says great information. She says, thank you. Great information. Connie Taylor is here and Connie says hello. And so does Denise Campbell. She says hello to everyone just as well because she is here with us on Couch Conversations. So I think you kind of answered our next question, but I think we have the next question 3 times actually. Can you have intercourse with your mate during monkeypox, and how long does it last?
I don't know if the question is, can you have intercourse with your mate during the time monkeypox is in the land? Or
that's all the question says. So I believe they're listening. If we need to clarify it, I think they may, maybe type something in to clarify, or anonymously send me something to clarify.
And then I'm moving really fast. I want to make space if any of my colleagues, because I know I'll go. She goes. You know what I'm saying? She goes. I'm on 150 right now, like Dr. Mason said. If any of my colleagues want to come in, and if I leave anything out, go ahead. If not, Okay, so 2 things. While monkeypox is in this space, right? The best way for me to start to protect my tribe is to limit the number of people I'm making skin-to-skin contact with, right? So right now it's on genitals, so I'm gonna limit the number of people that I'm having skin-to-skin contact with their genitals with, right? Right? So if my partner doesn't have any lesions, I don't have any lesions, and there are only 2 of us in this partnership, then right now things should be okay. Now, monkeypox is skin-to-skin, so I anticipate there will be a point where it comes out of the genital area because genital area is just one piece of skin, right? When you look up monkeypox on CDC, you're going to see the pox on the hands, things like that. Surprise! Don't get it twisted. Don't put labels on it and don't fit it into a box. These lesions on the hand will transmit the disease just as fast as the lesions on the genitals. I'm just going to let y'all know that, okay? So right now, because it's in genital, the way I limit it is limit the amount of people who I have skin-to-skin contact with their genitals, and Let's say my partner happens to, in the future, monkeypox another way, and they have lesions on their genitals. What I'm going to do is wait, until the lesion is gone, symptoms are gone, the scab is gone, because after the bump or after the lesion you're gonna get a pustule, which is like a bump with some juice in it. After that dries out, it'll be a scab. When the scab comes off and I got new skin, that's when I'm not contagious or at risk of spreading monkeypox. That new skin. So you're gonna wait from the pustule to the white meat to the new skin. That's it.
So what's that time frame? How long is that? What's that time frame?
That's a good question. So the time frame. So let's talk about time frames. If I experience or come into contact with skin to skin contact with someone who has monkeypox today, typically a week to 2 weeks from now, sometimes even 3 weeks, I'm gonna start to feel fever, fatigue, those type of things, followed by a rash that initially is just red, and then the bumps start to form. So a week to 3 weeks. Most people start to experience it right around the 7th day into the 14th day. That's when it hits, right? Now, monkeypox, the whole course, clears itself within 4 weeks, sometimes 6 or 8. Remember, these are averages. Right now, the average is about 4 to 6 weeks. It is something that's, for a lot of people, self-limited, which means it'll come, it'll go away in about.
Oh yeah, Rose Thomas died.
Yeah, but she put.
So
please inform the congressman.
Tony,
okay.
Thank you. Go ahead.
And so in that 46, it'll self-limit, it'll go away on its own. That's how long it takes, 4 to 6 weeks, sometimes 8, for the scab to completely heal and that new skin to come.
All right, fantastic information. Thank you so much. Well, I'm going to grab a comment out of our chat box really quickly, because Denise Campbell says, like COVID vaccines, can you still get monkeypox after being vaccinated?
A lot of people are not getting monkeypox after being vaccinated, fully vaccinated. So when we say that, the previous course was 1 shot today, 1 shot in 4 weeks, and then 2 weeks after that, I have my full superpowers. That was the previous course that was recommended. Now, they based that course off of what they saw in some regions for monkeypox, but mostly smallpox, right? So now they're looking at studies and looking at some immunity. They don't know the exact level with 1 dose. And so the strategy that the city of Chicago is taking right now is give as many people that first dose, trying to create that community immunity, right? Or what we call a herd effect sooner up front. Because remember, we have the ability to stop this by A, looking at the focus group, and B, trying to create what we created in 1972, which is we immunized and vaccinated so many people in that focus group. We were able to eradicate, like the virus won't have a place to land, and viruses need a place to land or they'll die off. So we're trying to make it die off before it spreads.
Hey, Maya, if you get it, do you get immunity afterwards?
If I get monkeypox, do I have immunity afterwards? So there's some studies that show if I get it, there may be immunity. There are some people, such as people that have had organ transplants and are on immunosuppressive, people that are living with HIV and their immune system has been impacted to a certain level, where if I get it and my immune system isn't high enough, it's high enough to heal, but not high enough to remember, right? It'll fight it off, but then it'll be like, all right, I'm tired. But remember, we talked about that immune system. With the immune system, my fully functioning immune system is supposed to fight it off, kick his butt, take a name, and then the next time. So Dr. Mason, you're asking me, does the average person that gets monkeypox, I'm not on chemo, I'm not on that kind of stuff, will I have some level of immunity? The answer for the most part is yes, they will have immunity. Now, the CDC and other entities are looking into whether or not that immunity is going to last. But unlike COVID, they're not thinking it's going to be a short-term last. They're looking 3 to 5 years down the line for needing immunity or booster or things like that. And remember, you do check in with your doctor and check your immune system, because again, if I don't have if my immune system doesn't mount the proper response, sorry, I'm going to need the vaccine.
Yeah, it only emphasizes to me how important it is to continue the message of let's have a healthy immune system. I mean, when I think I quoted the study about metabolic health and how now it's down. Tusk said there's 7% of Americans who are metabolically healthy, and people who are not metabolically healthy are people who are at risk from any type of illness, which is what those people were devastated by COVID. And although this illness is not as serious, because 99% of the people who get it will probably, survive it, unless you're in like the Congo in Africa, they may have a harder time because they don't have the resources we have. So they may be up to 10%. So it's not like COVID in terms of the impact. But what's clear is that if you have a functioning immune system, right, then you're going to do better. But if only 7% of us are metabolically healthy, then that means 93% of us are going to be at greater risk, which means it's going to impact us in a greater way. So we don't want people to panic about the monkeypox, which is why I appreciate my colleagues' comments to provide some clarity. But you're always being charged to, strengthen your body. So something as simple as how much sleep you get is critically important. And how many times have you been sleep deprived, or you've been traveling and you've had so much fun on a trip, you were sleep deprived. And then you shouldn't be surprised that you're more prone to be ill in that setting. It's not that it's like you're being exposed all the time. Your body's always fighting, but when you don't get enough sleep, you're going to be more likely to get an infection. So I think we all should pause and recognize that it's going to be monkeypox now. It's going to be something else a year or two after that. There's always going to be something, but what doesn't have to change is how your body is prepared to face all the challenges. So I just think that's really important. And anything that you can get from contact, right? Sometimes you're getting down to the level of cooking utensils and things like that, and bad stuff, the stuff you put on your bedding. So it's really important, I think, when you're in a family where somebody has it, you have to really start to be careful and think about, how do I make sure their needs are being met while making sure the rest of the family is not being exposed. So just be mindful of that. Thankfully, the pandemic has taught us how to do that. We're pretty expert at doing that now. And maybe that was the universe preparing us, so that when we don't want to go back to those old habits that have really increased our risk for being ill. And I have plenty of patients who don't get sick often, not because they are just metabolically healthy, but because they have habits that really reduce the risk of infection. I remember back in the good old days when, the guy who talked about washing hands before procedures was scrutinized and demonized. How ridiculous would you say that that's important? But then they found that he was right. But by the time they figured that out, he was already, pushed out of the medical community. So hand washing is something as simple as that. It's really important. Having awareness of what's going on with the people you're connected with, and just being thoughtful about the contact. I think you'll do better with that.
Outstanding. Well, Mary Ballinger says, good evening to all. And Vicki Townsend says, happy National Parents Day. Thanks for all the wonderful advice, information, and encouragement. I didn't know that today was Parents Day, and my two children who have 4 legs did not buy me a gift. So I'm going to have to find out what's going on around here, because if it's National Parents Day, Silver and Gold should have bought their mommy a gift. Now that we see that the congressman has gotten his technical difficulties all straightened out, we're going to reintroduce him again. And Maya, stop getting on Alpha for not getting you a gift. Maybe Alpha, Silver, and Gold got together, and we just don't know that they have our gifts yet.
Did they give you snuggles? Did they give you snuggles today? That was it.
Oh, you're right. I got snuggles today. So yeah, they did give me a gift. Okay. To the man who makes this possible for us on each and every Monday night, to the one who teaches us that true health is wealth, is our very own Congressman of the Illinois 7th Congressional District. That's Congressman Danny K. Davis. Congressman?
Well, why don't I just suggest that we move ahead and go right on? I'm enjoying listening about monkeypox, and I think we need all of that information we can get. There are levels of complexity to it, and people are wondering, what it all means and what they can do. So please, let's go ahead with that. And eventually we'll get this internet business, in the hood worked all out so that you can be in these storefronts and still have the internet work for you. But we managed and we're here, and let's go ahead.
Okay. Charles Edwards is here, McDavid Sr., and he says, good evening to everyone. Our next question says, it's time for me to have my COVID vaccine. Should I get a monkeypox vaccine as well?
Yes, and the studies show there's no problem with giving them right now. The studies are looking like there's no problem with giving them both at the same time. I do want to say, if you feel that post-COVID, that is more related to the COVID vaccine and not the monkeypox vaccine. So, yeah. And just to further answer what Dr. Mason asked, if I didn't ask Dr. Mason. You asked if you get it, then do you need a vaccine? Oh, well, if you get if you get monkeypox, it's 3 to 5 years, and then okay. Someone else is asking the question: if I get the vaccine, can I still get monkeypox? Right. So remember, the purpose of a vaccine is to decrease severity, lessen the chances you'll get it, but decrease the severity of disease should you get it. Remember, because my immune system is remembering what's in the vaccine. And then if my body encounters monkeypox, it's like, bam, on site, taking care of it. Hopefully before you have severe outcomes and, or really feel it. Now, just like Dr. Hampton said, the rate of fatality or severe outcomes for monkeypox can range from 0 to 11%, right, depending on community. Now, let's go back, Sankofa, let's go back to history. White COVID was not black and brown COVID. White diabetes is not black and brown diabetes, right? And so I anticipate white monkeypox ain't gonna be black monkeypox or brown monkeypox, right? That percentage 0 to 11, I anticipate, like every other disease since the history of man, is going to differ community by community, right? Because not only what Dr. Tony said, but also the resources and like just frank history. So what are we going to do? We're going to protect our tribe. We're going to do a couple of things. Right now, I don't qualify or I'm not eligible for the vaccine, but what I'm going to do is plan. So what does that mean? Okay, we just said it's skin to skin. So eventually I anticipate that I'm going to be eligible. Now, if I'm never eligible, then you can be like, oh, Dr. Maya, couch conversation, you told me to make this plan, I didn't use it. But if I am, if we do get to that point, I need to already know how I am going to get myself and other people in my community, in my zip code, in my neighborhood, where is the vaccine in our neighborhood? Find out now, start looking now, and then call your friends and y'all make a plan. When the city of Chicago says we're eligible, boom. Mary, you call in here. Nikki, you call in here. Ramona, you call in here. We're going, when you get it, when you find it and start making appointments, also try to make me an appointment. Text me so I can get on the line and be like, I want to make an appointment too. We have to prepare to protect our tribe again, right? So start preparing now. I'm not going to wait for them to say all the, I'm gonna be 45 soon. So all the 45-year-old people who don't identify as men who have sex with men go in and get it. I don't make a plan now. I need to know what a vaccine is. You know what I'm saying? I need to know. So you all, like before, and this is serious, please make your plans now. Should you be eligible, where will you go? Who will you call? Who am I going to bring with me? I'm going to bring 2 or 3 other people from my community with me. All right.
I love that. I think for us, we struggle, and we need to understand why we struggle. And I really think that's important. I think the rules are similar in terms of the information being shared, but if you are struggling and maybe even not even making this a priority because you're struggling, right? You may have, something as simple as you may not even want to go get help because you're thinking, well, I don't want that medical bill, right? Some of my patients literally don't seek care because they don't want the medical bill, or they, and if more serious things are happening, I don't want to pay for that ambulance because the last time I went to the ambulance, I got a $250 bill. I would like to live in a country where everybody had access to care and they didn't have to worry about these things, but these are the things that they worry about. Patients don't even have transportation to go to the clinic sometimes, so they may not get the help they need, get the vaccine they need. And they may not just have the education that they can get some of these things at their local pharmacy, or that their insurance may cover these things. So people in communities, Black, Brown, et cetera, and I would even argue communities where there's rural, like Tia Reed, who was, she shouted out from Central Illinois, right? She lives in a rural community. Do people in that community have access to information or the same level of education that we need them to have so they understand what we're talking about? And so there's so many factors that make people in communities of color struggle. And I think we're all charged with, thinking about our neighbors. As a clinician, I have to ask questions when people say, I didn't get the medicine, or I didn't get the vaccine, because some people don't get shingles vaccine because there's a cost that may prohibit that, for example. So I think we all are charged with thinking beyond just what the surface. Don't look at a person's situation or a decision they made and simply assume that they made the decision for reasons that you assumed was the reason. Very few people that I meet are not concerned about their health, are not wanting to be healthy and live a healthy life. But in our society, we have to sometimes step ahead of them and say, hey, I noticed you hadn't done it, any barriers. And then you may want to throw a few barriers in front of them, do it in a respectful way so that they understand you're not playing with their pride, right? I don't want to say anything that's going to make people not feel prideful, but at the same time, I'm not doing my job if I don't address the issues that become barriers. So I think as we think about how we reach more people, how we support more people, we have to ask the right questions. Thankfully, in our health system, with certain diagnoses like hypertension, if you come to our health system and your blood pressure is off, I am kind of charged with asking about how often do you exercise? Are you having any issues with housing? Are you having issues with getting enough food? I'm charged with asking these questions, and invariably I will have patients, not like the majority, but there's a good number that says, you know what, doc, I have been struggling, and you know what, I didn't get that prescription, or I didn't get the vaccine because when I went to the pharmacy, they said I had a copay, I didn't have that. And what sounds like a little money to you, it may be a lot of money to them. And I'm always shocked at particularly my seniors, because I have a large Medicare population. And I think about how much money they get, because nowadays people kind of think Social Security is going to, make it all right. And the reality is it was never designed for that. So they're struggling, they're making, they're getting $1,300, $1,400, $1,500 a month. And as you know, that's not going to really cover your bills. And that's all they have. So if you ask them to spend $50 for something, they're going to struggle. So I think as we talk about these topics, understand the information is valuable, but then if you know somebody in your life who struggles, maybe you can think about ways to help support them. Maybe you'll find out where they can go get a vaccine for free, or maybe get care in a way that's convenient, or maybe you're the one that's driving them to get that care because you understand they have issues. It could be something as simple as, could you watch my babies so I can go do this, because I can't go with my babies. So those are the things that we have to do as a community, so we can put our arms around each other and support each other.
Well, that's simply great. Thomas says, love your passion for all community. Dr. Tony, Doug, Dr. Miller, the congressman, and Nikki. Oh, you are true inspirations. Well, no, he didn't say all of that. He was really just talking to Dr. Tony. I just thought I would bring a little laughter here today. So thank you, Thomas, for your comment. Juanetta Payne, and Juanetta, if I didn't pronounce it right, I truly apologize. Juanetta, give me a thumbs up if I did good. Juanetta says, my youngest son is headed to college next month. How do we prepare him for monkeypox on campus? Well, that's a good question. All questions are great questions, but that's a good question.
Well, that's an interesting question. Definitely comment in a moment, Dr. Meyer. But it's the same conversation you have with your children. They're kind of like released, like, birdies out. I talk about protecting your nest. The kids are in our nest, right? And then your goal was to let them fly away, right? And so now they're flying away to college, whether this is the beginning or the end. And I think it's so important to let them fly away. That you don't want to not let them fly. But what's happened over the years is that you've given them so much information, you've given them judgment, and you don't know what they're going to do in those moments. But I always tell my boys, and I still tell them, the decisions you make can have a significant impact on your life. So it's very important that when you make decisions, you're thoughtful and you understand that there may be consequences. When you're young, and always remember that the maturity of a young person's brain is not fully developed till they're 24 to 25 or 6, right? So they may have poor judgment. So what you want to do is present some facts. And I think the most important fact is how contagious this is. And it's in that skin to skin concept that Dr. Meyer was talking about. I think you want to just have a conversation with them and just help them understand that there's nothing that's really more important than your health. And I really want you to understand how easy it is to get. And although some people do really well with this and they don't have, really severe illness, when you're in college, you tend to not get as much sleep. You're not necessarily eating the best. You're not coming home to a meal, even though it's probably available to you, but sometimes the decisions you make. So just make sure they understand that they're going to be more vulnerable if they're under stress, they're not getting enough sleep, they're not eating well. And when you put all of those things together, they can get sick. And who wants to spend a week or two or longer being ill? So I think you just have that conversation. Obviously, you could argue that that's a higher risk population in a way. They're young and otherwise healthy in a way, but in a way they're also high risk because of what I just talked about. So I think every decision you make as a family is based on your own interaction with your doctor and what you think is valuable. But at the end of the day, I do consider that population a higher risk population because of the behaviors that they have. And you just want to instill in them the same thing that could have gave you STD is the same thing that can affect you with monkeypox. And monkeypox is even worse because you can just touch somebody or, maybe lightly kiss them on a cheek. And next thing you know, you have this. So that's kind of my initial thoughts.
The only other thing I would add to that, Dr. Hampton, is that we need to make sure that our young adults make sure they know where the help is and what the help is called. Where's the health service? Where's this, if there's a student health service, or is there a nearby public health clinic, or those things, so they know exactly what they need to look for to get the very information you and Dr. Meyer are talking about. And, obviously they need to be careful. They used to say, if you lay down with dogs, you wake up with fleas. So you want to make sure that you got to be careful about the people that you choose to expose yourself to. And if they're exposing themselves easily to you and everyone else, that's a signal you need to look at. And the word gets around relatively quickly. At least I know it was 100 years ago when I was in college, but I don't know that part's changed that much at all. So that's only what I would add to that.
Absolutely. Dr. Mason, I was going to say the same thing. When I'm making my appointment and finding that was local to Chicago, I'm also going to call and find out, or not making my appointment, making my preparation and seeing where the vaccine is. I'm also going to call where my son is, or my daughter, or my child in college, and find out with them, have the conversations with them. One of the keys that we got to do in our community is, for a lot of people who are not yet considered eligible, because guess what? Just like every other disease, monkeypox is going to, remember, two parts of the disease. In this case, it's a virus. So what the virus is trying to do, and then how we respond as human beings, right? So we've already put it in the box. That means at some point, it's going to decide to come out the box we put it in, and we've got to be ready. So when I make my appointment, I call Ramona, I call Mary, I call Nikki, tell my child, make your appointment. Hone in on where you're going to get it, like you said. Develop a plan. What is usually their criteria? Look at what happened during COVID, right? Some entities would not vaccinate you if you weren't already a patient. Does that mean that my child needs to go and become a patient and establish a healthcare provider already there? That way, it's just a matter of, or is it a place where I can go and I don't need to be a patient? Start looking at the criteria now. There are lessons we just learned that we can definitely apply. I would advise I don't know if it was the latter or former, I would advise establishing a healthcare provider as soon as they get there. Even if they go in and be like, yeah, take my blood, yeah, diabetes, screen me, it was perfect, great, but you've established. And so now you know where to go, you know who to ask when the vaccine becomes available.
I would hope that at the colleges, particularly at the college levels, that the student health service or whomever is in charge of these kinds of things, just as they've done with COVID and other things, would make certain that people knew where the resources were on the college campus, whether they were provided by the school or provided by nearby pharmacies or provided by whomever is the person that's doing it. And I would actually say that, to your point, Dr. Maya, that when they find out, come back and share the information.
Mm-hmm. Yeah. The only other
get your shot first.
Yeah.
Put yours on first.
The only other thing that I'll add to this, which is a general health thing, I think that as we are beginning to see infections and various disease manifest themselves in the community at a greater level, health awareness and health and disease prevention is really a big thing for parents to really discuss with their children, so they can begin to look at it as so. I mean, most young people don't really think about getting sick. They think about doing things to enjoy themselves, but being aware that these problems do exist and that they can become an issue for them, and that they need not be afraid to interact with healthcare community is I think an important thing for families to begin to discuss. I know most kids now are seeing a pediatrician, but it seems like at that time the young people want to break away from those and become on their own. But to make certain that you've given them that, empowered them, that they'll continue to look at their health as a sacred and important thing for them, and to protect it.
Nikki always says health is wealth.
There you go.
The other thing, and
I stole that from the congressman.
Sorry, what happened?
I said I stole that from the congressman.
The congressman always says health is wealth, and so
he always says health is wealth, and I have adopted it because true wealth is health.
Yep. And then the other thing that just came to mind: if your family, or in this case, my child is going to college, if they're outside of Chicago or outside of the state, know what the local eligibility to them criteria is. In the city of Chicago, we have people who have experienced skin to skin intimate contact with other people who identify as men who have sex with men. In other places, the criteria might be different. So you also have to keep abreast of kind of what's going on. But those are usually easy to find on whatever city it's in or county's health department website.
Okay. Did we share what Denise Campbell said, that I'm having problems getting another vaccine because I got the COVID? You would move it and make me have to put my glasses on. How you moved it? I'm having problems another vaccine because I got my COVID vaccine plus 2 boosters, and I still got COVID. My trust factor in these vaccines have weakened. So, like Dr. Hampton said, I am working to protect myself by strengthening my immune system. Thank you so much, Denise, for sharing that. You know, Charles Edwards says county care covers transportation. I know that there was some question about transportation, and I want to thank Charles for sharing that. But I want to add just a few things to that just as well. Our office, the office of Congressman Danny K. Davis, we have received a small influx of calls in reference to gas prices and getting to dialysis. So I just want to shift this conversation for just a quick minute because I want to share some resources about that. And so please grab this information and take it off to your tribes. There is transportation provided, which does not remove your independence as someone who may be going to a doctor. So I definitely want to share with you that there is a social worker at every site where you have to undergo this type of treatment, such as dialysis. So there's a social worker there, and that social worker should kind of be navigating that floor, asking patients, how are they? Do you need anything? And they're going to also ask you about transportation. So in this case, even if you are at a position where you may have private insurance and you don't take PACE or anything, they are offering that in case you may need some assistance getting to your dialysis appointments because of the cost of gas prices. Let's give a great hand to our governor and everyone for making sure that these prices are coming down slowly, but surely. They are coming down. So for all of the people who I know, like myself, who car only burns premium, I have been walking a whole lot lately. But understand that those prices are coming down some and that there is a resource there. So you can get a PACE ride. And they do have some other transportations that they are offering now. I don't know anything else right now in reference to gas cards. So I want to be clear. I know nothing about that, and I don't know anybody that's offering that at all. But I do know that the social worker will have a conversation with you. Even your primary care physician and your nephrologist may ask you those conversations just as well in reference to how is your transportation going. And know that the social worker can provide you some additional assistance in every healthcare system with making sure that you can get there. So I just wanted to share that. I wanted to thank Charles for activating my memory so I could remember to actually share that and to know that county care actually covers transportation and things just as well. Juanetta says, thank you. Juanetta says, thank you for that great information that was shared. And Sandra Rose shared that the Student Health Services always direct students to the ER, even though they have health insurance, SMH. So she is shaking her head. So I think they're working on that to make things just a little better. But thank you for sharing that with us on today. Thank you so much. Mary Ballinger says, Nicole, Nikki Harvey, hey, cuz the gas did make us work in a bit more cardio, though. You are absolutely right.
Health is well.
Not as much cardio as Dr. Mason has now. Trust me, not as much cardio as he is doing. But it made me kind of, I've even pulled my bike out. I will be on my bike this weekend. But yeah, but you are absolutely right. Miriam, thank you so much for sharing.
Let me
I'm
circle
sorry.
back with you real quick. I was thinking about
Okay.
the comments that were made by Denise Campbell. I actually know Denise because we worked at Circle Family Care for many years together. And I drove by Circle Family Care, which is a federally funded clinic that was on the west side of Chicago. And I do miss that clinic. That's where I kind of got my start. And we took care of patients in that community, which is a community I grew up in. So my heart is still there. But I just want to, when you think about COVID, last time I looked this up, I mean, like 60, 70% of Americans have had COVID, right? So when I think about the vaccine, I am not disappointed when I understand that it's hard to stay away from it. It's like ubiquitous in our environment now. However, I always remind my patients that the vaccine's purpose is to prevent you from dying and having severe illness. So we should walk away from any conversation about COVID vaccine understanding that that's what the purpose was. It wasn't to not get the infection. If you're exposed to it, you will probably get the infection if you're exposed to it. But the goal is to have your armor on and your weapons ready to fire, so that when that happens, hopefully you have a strong immune system because you're taking care of yourself, and hopefully you've prepared your soldiers with the exact weapon it needs to literally pop those harmful organisms out of your body. So I think as long as we're getting COVID and we have like these, respiratory symptoms that are similar to a cold, like a bad allergy, and you're like a week later, you're fine. That's what we're looking for the vaccine to do. And so I think it is disappointing when you get exposed. But if you think about when I went to Austin, Texas recently for a KetoCon, there was very few people wearing masks, right? So I think in certain environments so if you're in an environment like that, but yet you see all these COVID cases, then you could imagine that the chance of getting it. So I think we're doing really good. I actually celebrate the fact that so few people are dying from COVID these days, at least, just in totality. And so I think it was a miracle when they came up with the vaccine quickly. And yes, I'm not sure that the vaccine's not as strong. I think that we're just being exposed at a level that we hadn't been because everybody's kind of put their guards down. And so it's hard to be around people who are not around people who may have COVID. So you're going to basically get exposed. But I think we're doing good. So I just wanted to throw that out for Denise to reflect on.
I just wanted to throw out one other thing. Thank you, Dr. Hampton. Just another thing, particularly as we relate to sex, because we know what happens on the college campuses and what have you with regard to sex. And though we've been talking about monkeypox, I don't want you to forget that there's another group of sexually transmitted diseases that are still out there. And we still have very high rates of gonorrhea, depending on where you are. We still have, so there's HPV, there's all these other things. So take the time, if you're going to go see one of the professionals or get information about all of it. Get information about HPV, get it for gonorrhea, chlamydia, all of these different things, because they still could be there in addition to, or even if you don't have somebody with monkeypox, they could have something else. So just make sure that you have your sexual health that you're well informed on sexual health, just to be on the safe side. It won't hurt you.
Just a little unmuting.
Doug, you look like you had something to say.
Not at this time, no. I wanted to support what Tony said, but I had another thought. And it's not that the vaccines aren't good, but this virus has changed. It's not the same virus that it was 6 months or 12 months ago. The shape of this virus now has a different form, so some of the older vaccines don't recognize it as well. So that's why in the fall they're going to change the vaccines to adapt to the new shape of the new variants of the vaccine. So it's not that they're bad, this virus is a very, very sophisticated and clever enemy and shouldn't be underestimated. And so, like what the Dr. Hampton said, it protects you from going into the hospital and needing intensive care. That's a pretty good job.
And know that these variants have been playing a whole dance game. They have a party of their own, and they actually have their own posse that's going along with them. I mean, right now, our newest COVID strands is BA4 and BA5. Now, remember, we had Alpha, Lambda, Delta, Omarion. No, that's not his name. That's what the kids was calling him. Omicron. The kids were calling him Omarion. So, I mean, there's been so many variants. They have their own posse. It's like they just riding up, jumping out. We're going to call them the jump out boys. Let's be ready for them when they jumping out. When they jump out, we're gonna be vaccinated and ready to catch them and grab them and keep on moving so we can stay healthy and keep our, as Dr. Maya would say, our tribe healthy. Well, Ms. Leaks is here, and she says, thanks for the valuable information that you shared on tonight. Chief Tally is here, and Chief says, this is really good to hear. Tisha J says, thank you. Sandra asked a question, does local government still offer discounts on public transportation? And she asked a question about local governments offering carpool services. Well, I think carpool services kind of got a little sided once COVID happened a couple years ago, and I don't think that's been activated yet because we are not post-pandemic yet. So I think that's been actually put on hold, but I think it's worth looking into see if local government still has discounts on public transportation. So that's something that we possibly need to look into. Well, Rosalind is telling someone named Tolliver that her twin is on the panel. So whoever here has a twin, your twin is on this panel, I guess. And Juanetta Payne says, these are real health conversations. I was born and raised in Chicago, living in Charlotte. Please keep it going. We do not get this forum often. Well, Juanetta, tell all your friends to join us right here every Monday at 7. We're right here at Couch Conversations every Monday night at 7 p.m. Dr. Maya just wanted me to share that she had to jump off to go to a monkeypox meeting that a lot of us actually have to kind of attend. But each and every Monday night, we share a message called Until Next Monday. What is our until next Monday? And Dr. Maya texts hers to me and she says, it's time to protect our tribe. Start the conversation now. So she wanted to make sure that she did not leave without sharing her until next Monday. So Doug, you are next on deck. You are the next batter up to tell us your until next Monday.
So I think that eating healthy is part of this, staying healthy. And what I'm going to suggest is try going to the grocery store at a different day at a different time. Because I can tell you when I go on a Thursday or a Friday or a Saturday afternoon or evening, it's packed, you're in a hurry, the levels of stress are a little bit higher, and the Doritos end up in your shopping cart. But if you go in a time when there's fewer people and it's calmer, you got a chance to check out the fruits and vegetables and the berries and the good stuff. So if you get a chance, try changing the time that you go. When it's more relaxed and quiet, it'll be easier to choose the right things for me.
Outstanding. Well, the next batter, Dr. Tony Hampton, batter up.
All right. So again, the mission here is to share information so that people can have a different perspective, see the world through a different lens. One of the things that I will share very soon, probably the next time we meet, is there's a CME, continuing medical education opportunity for our clinicians, because a lot of times, believe it or not, they may not see the world through the lens of communities of color, brown people, Black people, etc. So in order to help engage them, maybe they can learn some of these concepts in an environment where they can get continuing medical education. So that's something that is being worked on. I'll make sure to share that once it's available. But I just think that we have to keep talking to each other. And I think we want our clinicians to be, empathetic to all the things that describe the struggle. And if they understand the struggle, and then we create resources as are being discussed tonight, then we will then have a path to help people heal. So I'm looking forward to that. I'll make sure to share. I thank the congressman again for the opportunity, and let's keep doing this, guys.
Outstanding. So Mary Ballinger says, we are so blessed to have all such accurate and valuable information. Thank you all so much. So we have one batter on base 2. We have a batter on base 1. So, Doug is on second base. Tony is at first base. Dr. Mason, we got to get Doug to third base. You're the next batter up. Let's go. We're in start next Monday.
I would say just very quickly and succinctly, use what you've heard. There's been a lot of information that you get every week, and we want you to use it before you lose it. So if sometimes maybe next week when we get started, get you a pad and a piece of paper out and make a note, or speaking to your phone, make a note to your phone. It's interesting and good information that we want you to have, and don't want you to lose it once we go dark tonight after we're finished. So make some notes before you forget, so you have something you can use, and at least make one or two, and make a commitment that you're going to try and follow that recommendation. It's to find, where your health service is, or to do whatever it is. If it's just to do some more learning about these things, there's a lot of information out there. So let's use what we've got.
Outstanding. Well, Tia says you guys are amazing, and thank you so much. Well, right now the bases are loaded, and we got to get one person home at least. So Dr. Miller, I know there's a lot of pressure because the bases are loaded. Bring Doug home. You got to at least get one base free. Bring one of them home. You're until next Monday.
Until next Monday. This is really all about preparation. And preparation and learning is only good if you make it active. Use what you get to prepare yourself to be able to be healthy, to be healed. So this information is not not for entertainment. It is to help. And in order for it to help, that means that you begin to make this active, make this your life, make it how you approach your life, make it how you see your health. The things that it really is in your hand to a large extent. And because you're the only one that's with you 24/7, therefore you're the only one that can take this information and make it valuable and make it useful for yourself. Getting it in your head without using it does nothing. But if you take it and you use it, whether it be about nutrition, or whether it be about a virus, whether it be about exercise, use it, and then it will be effective and you'll be healthier.
All right, Dr. Miller. Well, Doug made it home. We've made a point. Mary Ballinger says, indeed, Dr. Mason, for sure about making those notes. Now, Congressman, the bases are loaded, and you are the next picture. Make a home run and bring everybody home. Let's shut this game down.
Well, the home run is I'm going to be leaving here in the morning, heading back to Washington, because this is our last week of legislative business before we recess for the summer or for August. And of course, it's going to be a very busy week because we're going to try and put in place everything that we can while we have the opportunity. And so while, as my mother would say, the blood is running warm through your veins, you better do everything that you can. And you got to work while it's day, because when night cometh, you have a more challenging time. So we know that we are in the majority in terms of people who think the way that some of us think. We're going to try to get as much done this week because we know not what the environment might be when we get other opportunities at this. So I end by saying, while the sun is shining, do as much as you can, because when the sun goes down, it becomes a bit more challenging. So work while it's day. Make use of all this great information that you have been given and have received. And that means that our days will be longer and the sun will be brighter. Have a great week. We'll see you next Monday.
Until
Oh.
then, good night, all. Remember to mask up and wash your hands. So important. Have a until next Monday.